Hi everyone, this is Danelle. Happy Physical Therapy Month, and today I'm going to be talking to you about shin splints. So shin splints, or medial tibial stress syndrome as it's called in the medical world, describes the injury that happens when you have pain along the front of your lower leg or your tibia, and describes really the pain that happens at the attachment site of the muscles of the lower leg as it attaches into the periosteum or the bone tissue of the tibia. Okay. Females more than males tend to get this particular diagnosis, and people who are runners and do a lot of jumping or ballistic activities, such as volleyball players, soccer players, tennis, dancers, or anyone that has recently started an aggressive training programs that involves a lot of running, will find themselves with this particular diagnosis. You feel that you have pain when you've started your activity. Sometimes it goes away, but as it progresses, you will find that also simple things just as walking and standing, you're going to feel pain along the front of your leg. To understand this diagnosis a little bit more, we're going to get into some of the anatomy here. And again, as I said before, this is pinpoint pain that happens at the attachment site of the muscles as it attaches into the periosteum or the bone tissue of the tibia. Okay, so looking at the three major muscles that are responsible for some of these problems, and again, there are different muscles that attach to the tibia, but these are the major ones. We have the tibialis anterior. You can see here this long, broad base attachment as it attaches to the front of the tibia. And then as we get towards the back, we can also see that there are two other major muscles. We have tibialis posterior. Again, you can see that long line, long base attachment. And we also have the soleus that is here. And again, you can see that long base attachment. So as you're going through your dynamic activity, as you're running or you're jumping, you can see that as these muscles act in that way where it goes from kind of diffusing or dampening the force as you land and transmitting those forces all the way up through the leg to going to a lever system where it's kind of propulsing you forward as you go through that motion. That broad-based tugging along the attachment site is really going to be the cause of the pain in this particular diagnosis. Something to be really aware of, and that's really important with this particular diagnosis, if you think that you have this going on, is that it's important to get an accurate diagnosis. Get in contact with your orthopedic physician or your orthopedic PT like myself to get an accurate diagnosis, because it is the beginning of a continuum of injuries that can occur at this location. It actually starts with shin splints, where again it's that irritation of that attachment site, but it can progress to either a stress fracture or an actual full fracture of the bone, where that continued irritation starts developing into a deeper sort of injury into the periosteum and the bone itself. For that accurate diagnosis, you want to have someone who's had experience in these particular types of injuries and can decide if your pain is only coming from that irritation or there's something bigger going on. If there's another diagnosis that's going on, the plan of care and the treatment interventions for that is very different. So you want to make sure that you're starting with the best diagnosis possible so you can get the best intervention and get back to your sports or activity relatively quickly. If you have the wrong diagnosis, you have the wrong treatment, it just means that you are out longer and that you're missing the thing that you would like to do for a lot longer. So again, if you're having really that pain in the front of your leg, contact me and I'm happy to take a look at you and tell you exactly what needs to be done. With a physical therapist, in terms of what we can do to help, we do a complete biomechanical analysis because there are multiple things that can be the underlying cause of this particular injury. And it can go from muscle imbalances to a previous injury that's now factoring in your training. It can be improper shoes, and again, other different factors that can factor into this, and addressment of each of these particular factors are going to give you the best outcome in terms of resolving your pain and getting you back to running and doing the fun things that you love to do. So that is shin splints in a couple of minutes. So put some comments below if you have specific questions, let me know, and happy Physical Therapy Month, guys.